Hey, hematology heroes! Ever seen a patient with unexplained fatigue, easy bruising, and recurrent infections and then a CBC that changes everything? That's the world of leukemia, a cancer of the blood and bone marrow that alters the very cells meant to protect us. Today we're diving into what leukemia is, how it presents, how it's treated, and the vital role nurses play in managing care and restoring hope. Leukemia is a malignancy of blood-forming tissues, especially the bone marrow, resulting in the overproduction of abnormal white blood cells. These immature cells crowd out normal blood components, leading to anemia, immunosuppression, and bleeding risk. There are four major types: acute lymphoblastic leukemia, AL, which is common in children; acute myeloid leukemia, AML, which affects all ages and aggressive; chronic lymphocytic leukemia, CLL, which are slow-growing and often seen in older adults; chronic myeloid leukemia, CML, which are marked by the Philadelphia chromosome. Recognizing leukemia symptoms: think ABC, anemia, bleeding, and compromised immunity; fatigue, pallor, shortness of breath, anemia; easy bruising, petechiae, frequent nosebleeds, thrombocytopenia; recurrent infections, fever, neutropenia; bone pain or tenderness; swollen lymph nodes, splenomegaly, night sweats and weight loss in chronic types. Diagnosis and treatment methods: CBC with differential, shows abnormal or immature WBCs; bone marrow biopsy, confirms type and blast percentage; flow cytometry and cytogenetic testing, identify subtype; lumbar puncture, check for CNS involvement in all, depends on leukemia type, age, and comorbidities; chemotherapy, backbone of treatment, often in phases, induction, consolidation, maintenance; targeted therapy, tyrosine kinase inhibitors, for example, imatinib for CML; immunotherapy and monoclonal antibodies, for example CAR T-cell therapy; stem cell transplantation for high-risk or relapsed cases; CNS prophylaxis, in all, to prevent brain-spinal cord relapse. Nursing interventions: monitor for myelosuppression, track neutrophils, platelets, and hemoglobin; neutropenic precautions, reverse isolation, strict hygiene; educate on avoiding raw foods, crowds, and sick contacts; bleeding precautions, avoid invasive procedures unless necessary; use soft toothbrushes, no rectal temps or suppositories; monitor for internal bleeding, GI, hematuria, bruising; infection, surveillance, frequent vitals, assess for fever; prompt culture and antibiotics if febrile; maintain line care and strict aseptic technique; support during chemotherapy; manage side effects, nausea, mucositis, fatigue; offer emotional support and family education; coordinate psychosocial services, especially for pediatric patients. Leukemia disrupts the body's foundation, but with early detection and compassionate care, remission and recovery are possible. As nurses, we help manage the complexity and protect the human spirit. What's your best tip for caring for patients undergoing chemotherapy? Share below, like, subscribe, and follow for more hematology oncology care, because every cell matters.